Welcome, everybody. I'm Julie Block, President and CEO of the National Eczema Association. Happy Eczema Awareness Month. We're very excited to share today some results of one of our initiatives for October Awareness Month. Our theme is Unhide Eczema, and we want to thank you all for joining with us in doing just that. It's my pleasure now to introduce Dr. Gil Josipovic. Dr. Josipovic is the professor and director of the Miami Itch Center, Miller School of Medicine at the University of Miami. More importantly to us, Gil serves as the chair of our scientific advisory committee, and he's been a long-time champion for the National Eczema Association, and I'm pleased to have him with us here today to join me in sharing with you, our community, the results of the first in a series of surveys we're doing during Eczema Awareness Month to unhide eczema. The first survey we have fielded is on adult eczema, and we thank the 719 adults who have to date completed the survey, and we're going to share some of the top line results with you. That survey will continue to be open, and we invite your input. So Dr. Josipovic is going to start us out with one of the very fascinating data points that we gleaned from the survey results.
Well, thank you, Julie. It's really an exciting time, and it's a wonderful information that we obtained from this survey. And I'll start with stating that something that was not maybe new to me, but I think that a lot of our patients and need to know that the disease of atopic eczema is not just exclusively of kids and children. The survey clearly demonstrated that it's a major problem in adults. And I hope that this will also raise awareness among a lot of other caregivers and also in the community. There's also an issue here that that the prevalence of atopic eczema has been, most of the studies were focused on the childhood, but the issue is that there is almost 3% of adult population suffers from atopic eczema, and in this survey it showed that 45% of the responders stated that their eczema started in adulthood. So I think this is an unmet need. And then a lot of times when doctors tell their patients, well, you didn't have it when you were a child, so this is not atopic eczema, this is incorrect. So this is a very important part of the survey.
Yes, it's a very important finding. And for our community, you'll notice that Dr. Josipovic refers to it as atopic eczema. We say eczema. We know atopic dermatitis, which this is this statistic of the 45% of adults who responded said they got it after age 18. So you've heard this from me before, but that we use these terms interchangeably. So I just had to call that one out, Dr. Josipovic.
Okay, you're perfectly right.
Yes. And it's a confusing point for patients oftentimes. Do I have eczema? Do I have atopic eczema? Do I have atopic dermatitis? So fair enough. The next data point that we found really interesting in the survey results that you shared your information with us in our community is that 20% of the respondents have seen 9 or more healthcare professionals in their life for eczema, and 45% of you have seen 5 or more healthcare professionals in your life for eczema. That's a lot of doctors to go and see. And I think that that speaks to a few different things. I think it's a lack of understanding between the patient and the physician on what the expectations are. I think it shows that patients' dissatisfaction with the treatments lead them to go to another doctor hoping for a different answer and a different treatment. There's a disconnect there. There were 45% of the respondents to this survey are reported they are somewhat to completely dissatisfied with their current treatment. So as we can see, patients are not getting the health outcomes that they wish for with the current treatment regimen. They go to several doctors to find it. We'd like to see in future years that trend go down as new treatment options come on the market, and we train up healthcare professionals to prescribe treatments that are going to be the best for each person. So we're going to be keeping a keen eye on that particular statistic moving forward through the years, and hope that we see a lot more satisfaction with treatment and a lot less doctor hopping. So I will turn it back to you, Gil, for our next data point.
Yeah. Well, another important data point was that 71% of responders mentioned that they have symptoms of or been diagnosed with anxiety or depression. And 56% of these symptoms of depression, 65 of patients said that the symptoms of anxiety were prevalent. And only 36% of patients that filled the survey were diagnosed by a healthcare provider with anxiety or depression. And I think this is an important aspect of this disease, is that we are aware that there's a lack of sleep, there's an impairment in quality of life, but when you have all the suffering from this disease, it affects the overall mental health. When you don't sleep, when you itch and you scratch, it affects your mood. And clearly, we last year, there's several studies of the last 3 years. My colleague, Dr. Silverberg, and others in Europe have shown that there's a significant association with depression and anxiety with this disease. So I think this is an extremely important point that NEA has been for years kind of promoting, that it's a holistic approach is important. It's not just enough to give one topical. It's important to discuss these issues with the patients. And nowadays that we are having kind of a flare of new drugs, we'll be, I'm sure that we'll be improving the quality of life, and it will help also the depression and anxiety that is involved. But we have to remember these issues, because a holistic approach would help significantly our patients.
Yeah, absolutely, absolutely. And I think the National Eczema Association will be advocating that screening for anxiety and depression should be a standard practice with eczema, and appropriate referrals should be made for that patient. Very important topic, and we will continue to advocate appropriately and learn more. As we've also learned that, eczema, or atopic dermatitis in particular, is an inflammatory disease. We know inflammation is also now part of depression and anxiety. So new research is emerging on that very topic. So we do anticipate that when patients get treatment for their atopic dermatitis that brings the inflammation, systemic inflammation, down in their body, that we can also see an improvement in mental health conditions too. So there's good news there, but nevertheless, shocking data point that 71% of the people that responded to this have symptoms of or have been diagnosed with anxiety or depression. It kind of breaks my heart. So I'll go on to the next data point. That the final one that we want to share with you from this particular survey is that 58% of the respondents believe that their healthcare providers understand the impact of eczema on their daily life very little or not at all. So nearly 60% of people think that their healthcare professionals don't appreciate the impact that this disease has on their quality of life. So that suggests that we need better education to healthcare providers, and NIA is doing that through some of our Coalition United for Better Eczema Care, some of our healthcare provider education programs. Again, as Gil said, we've got to treat the whole patient, not just a rash on the arm or the leg or wherever it may be. And another point along this line of the healthcare provider not really appreciating the impact on quality of life, 30% of the respondents in this survey also let us know that they spend an hour or more each day on their eczema care. An hour or more a day. That's a significant amount of time. And sharing this with a healthcare provider and talking about treatment options and so on is an important part to their relationship. So that's just a tip of the iceberg of some of the data. I want to thank our community once again for providing your input. It is essential that we do this work. This is how we learn what is going on in your lives and how we can best advocate. Next week, please, is our survey on our community, so we can get to know you better and who you are and what services you want from us. The following week, the survey is on advocacy, and we want to know about your access challenges. And lastly, the final week of Eczema Awareness Month, we want to hear from the caregivers and how this disease impacts their lives and their children's lives. So I implore you to keep answering these surveys and giving us this data, and we will report to you every Friday in a little video like this with many of our experts in our community to give you some of the highlights. And we thank you once again, and go unhide eczema, hashtag unhide eczema, and share your stories with us and with your communities so that we can all work together towards having a better life. Thank you. Thank you again, Dr. Josipovich.
My pleasure. Thank you.
Thank you. Bye-bye, everybody.